Sacramento area emergency rooms filled to capacity, impacting wait times and treatment. But doctors say the people taking up beds should be getting care elsewhere. KCRA 3's Claire Dewan explains who those patients are and how everyone is affected.
It glides through the emergency room at the Mercy San Juan Medical Center.
How are you? What's your name?
Nancy.
Hi, Nancy. I'm Dr. Kazi from telemedicine. I'm here to see you today.
A robot that allows a remote psychiatrist to connect with people suffering from mental illness.
Well, I've been feeling a little anxious.
It's one way Mercy San Juan Hospital frees up its ER doctors and nurses to deal with physically injured patients. Medical directors say there is an increase in psychiatric patients, not just here, but also at Sutter-Roseville Hospital and at the UC Davis Medical Center.
Patients with psychiatric complaints require additional resources. They require additional nursing. They require security. They require specially trained individuals that others may not need.
There are an estimated 350,000 people in Sacramento County suffering from mental illness, and a third of them are afraid to reach out because of the stigma, according to the county.
That's what the stigma in the community is that if you do go to therapy or if you do need help, you're crazy, you can't handle, you're not strong enough.
Lyshia Rockman-Jackson hid her depression for years before reaching out for help.
And if I did tell someone, I didn't tell them I was on medication, because even then that would mean now you're certifiable crazy.
And because of that stigma, many suffer in silence until a crisis sends them to the ER.
I'll be seeing every single patient every single day.
Doctors with the Sierra Sacramento Valley Medical Society say it affects the treatment and wait times for everyone.
If a patient that has a mental health need is spending a prolonged period of time in the emergency department in a bed, that bed is not available to someone else who may come in with a non-mental health need.
Clinicians say this is caused by the lack of preventative care, made worse in 2009 when Sacramento County cut services due to dwindling budgets.
Sacramento County did close their inpatient psychiatric unit, and as a result, a lot of the patients that normally would be stabilized and seen within that type of institution are now presenting to the emergency room.
Doctors are pooling resources to look for a long-term solution, but it won't come easy.
If I was going to say what is the most important initiative, would be opening of inpatient mental health beds in the county. That would be number one on my list.
There are services available, like the newly opened TLCS Mental Health Crisis Respite Center in Sacramento. It's funded by grants and free for any adult in crisis, hoping to provide them with safety and stability.
We get calls from housewives that are overwhelmed with child care responsibilities, that sort of thing. We get calls from people who have persistent and severe mental health that have bad days, and we're available to everybody in between those continuum.
But one of the biggest challenges remains getting people to speak up about needing help way before resorting to the ER.
It becomes really difficult for people to even admit that they have a mental health condition that needs to be treated. And so we have to be aware and sensitive and compassionate to those who do suffer, because there's enough stigma as it is.
And until more help comes for mentally ill patients, hospitals will have to continue being resourceful. In Sacramento County, Claire Dewan, KCRA 3 News.
Sacramento County will be rolling out a number of programs for mental health. They include training for police, mobile crisis teams, and psychiatric help for people in jail.